Good day, everyone. I'm Sam Silva. I'm a Medicare insurance specialist. I consult about the health insurance for senior market as well as people who are with disability that who are eligible for Medicare benefits. Um, I have a team of agents who works with me, my partners, my colleagues. You would able to see them and contact them down toward the end of the slides. Jim Collins, Barbara, Nancy, Anna. We are dedicated to simplify and help you to understand what Medicare is. It's a very complex subject when it comes to health insurance. We can simplify in a language that you can understand what kind of benefits and what you should get and what you should not get, and in things in that nature. And moving to the next slide, this is your original Medicare card. It states Medicare Health Insurance. Uh, Taking you to the insurance part of it, it's a bit of a controversial term because this is not 100% full coverage for your money, meaning that you will have to bear certain percentage of cost, deductibles, co-insurance if you just use this card as an insurance card. The term insurance is a liability coverage which covers you from um, excessive liabilities and excessive amount of charges and payments. So this does not have a safety net, nor does it have a maximum out of pocket. So that is not a recommended plan for anyone seeking for medical help and attention. We always recommend to go with Advantage, Complete, or supplemental plan options. And being said that, let's move into the card name. This is the name where your name is going to be printed. The alphanumeric number is the card number, which is a crucial within this card. And the alphanumeric number gives this card a bit of a higher security in comparison to this card's predecessors before 2016. Hospitalization is a part A. It covers your hospitalization with deductibles and certain insurance. So it does not cost you unlimited amount of charges if you were hospitalized just by using this card. At the same time, Part B is a medical. It's also called outpatient coverage. You can see doctors and go to clinics with the Part B portion of the card. And Part B also comprises of a certain deductible and co-payments or co-insurance that carries with the Part B portion of this card. These are the effective dates when you receive these benefits. The first date that the benefits can be um, utilized is other dates here. These dates could be the same most of the time, but certain occasions the B date can be a later date depending on when you obtain your Part B. If you're working beyond your retirement age, this date could be at a later time. Moving to the next slide. Limbs of original Medicare deductible, co-insurance, and gap. As you can see on the Part A, there is a $1,556 deductible when you first admit yourself to the hospital, and after that, if you stay in the hospital beyond first 60 days, you would be liable to pay $389 co-insurance per day up to 90-day period, and then beyond 90 days you will be paying $778 co-insurance till you discharge from the hospital. So these are really huge sum of money that individual cannot bear to pay out of their pocket. That's why we always recommend to go with a complete or advantage plan or a supplement or gap policy. And when it comes to Part B, in 2022, there is a Part B premium, which is $170.10. This is not just for individual by yourself. This affects all 62 million Medicare recipients in the country. Depending on your income, this number can rise up from as a form of premium, which will automatically comes out from your Social Security or railroad account. Some are unaware that this has been deducted, but it is been deducted for everyone. There's no going around it. Only thing is there are plans, there are various programs that you can benefit from and get incentives toward this amount and get the money back, called the give back programs that we deal with. We can help you to reduce the cost of your Part B premium. And moving on to the deductible, whenever you go to see a doctor first time, you are liable to pay Part B outpatient deductible, which is $233. On top of that, you are liable to pay 20% of the remainder of your bill. For example, if you go to your specialist or a primary care at the beginning of the year, or the first quarter or second quarter, if you go there just the first time, your bill comes to 1,233. Then you have to pay the 233 as a deductible, and then after you have to pay the 20% of the remainder, which is $200 from $1,000 of the balance. So approximately you will be paying close to 450 on your first visit. But every consecutive visits, if you go, if your provider charges you $1,000, so you are liable to pay 20% of that. If it's 500, it is $100. So these costs are in the nature which are unbearable and huge sum of money, and there is no safety net. It's unpredictable how much you would end up paying in a single year because there is no safety net, there is no maximum out of pocket in these original Medicare plans. That's why we always recommend that you do not stay with the original Medicare. You go with a plan, you consult us, you talk to us, and then see which route that you should take. You can go with the Advantage route or you can go with the supplement route. And we will highly encourage you to get a plan as soon as you turn 65 and when you are eligible for your Medicare benefits. Moving to the next one.
As we talk about the gaps of the Medicare on the slide 6, and these are the options that which can fulfill the gaps of the Medicare. The option 1 is a supplemental or the gap option. It's fulfill the gap of original Medicare and provide you full coverage by eliminating the deductibles and 20% that you have with the original Medicare. Like the original Medicare, the supplement plan does not have any drug component. You have to add a standalone drug plan in connection with the supplement plan. And supplement option is also a burden-free option, and it's a network-free option. You can see any position without having a specific network of doctors. So it's a burden-free option, and it's a pretty good option as well as little expensive option in comparison to the second option, which is option 2, which is my favorite and many of my clients' favorite option. It's also called the Medicare Advantage or Medicare Complete Plan option. It completes all your health needs for a fraction of the cost, in most cases zero cost. It covers you from hospital, doctors, prescription drugs, and additional benefits such as dental, vision, food care, and some plan even offers OTC, over-the-counter essential, that you can purchase at the pharmacy. So this is a very well designed option for anyone who's turning 65 or who is looking to get a safe coverage to safeguard their gaps of their original Medicare.
Here is something apart from the health insurance or the Medicare options that we also go out of the box and out of our comfort zone to help clients who wanted to find out about their Social Security's benefits, increases, the amounts that they receive in that nature. We encourage everyone to create their own online Social Security account through the socialsecurity.gov. We will do a free consultation and education event in the future about how to do that, or if anyone interested, they can always call us. As you know, in 2022, the COLA, or the increase of your benefits, has jumped up 5.9%. For example, if anyone who has been receiving $1,565 as Social Security income now will receive $1,657. So there's a $100 almost a jump there from 1565 to 1657. And anyone who's getting 2,500 or more, they have increase of about $150, more than 150. So that likewise there has been increases to your Social Security income. Over the years, these numbers changes annually, and it's a good thing. It's a burden-free thing, and as the talks of the Congress or the government, they have implemented these increases to help seniors to better their lives and better their financials. It's about $100 to $200 a month increase. It's a quite a good increase in this time of the day and age. And with that, when we move to the next slide, in conjunction to the Social Security income increase, you can see there is an increase on your Part B premium. The Part B premium for the previous 2021 year was 148. So now the new premium is 170 and 10 cents. So it's about $23 approximately increase from the previous year. This may seems a little bit big increase for you, but in comparison to the Social Security income, this is a very small portion. So it is what it is. When the year comes, always there are increases to your income. At the same time, it correlates to the Part B premium. That's how the system is designed. Not many people are happy with it, but keep in mind, you also has got a 5.9% increase on your Social Security, which is drastically higher in comparison to this $23 increase on the Part B premium. And with that, there are other increases. These are deductibles, and when you go to doctors, and these are also co-insurance when you are in the hospital, and deductible when you are in the hospital. Now these things seems very large, but with our help, you can eliminate all these things, and we will give you plans that you do not have to burden yourself, or you will not be incurred a high cost of medical expenses such as this. So don't worry about it. Just keep your mind clear and in a one focus. We will help you with this, and as well as certain plans we have can help you to get back a portion or all of this amount back to you. Moving to the next slide. Thank you for listening and being part of this educational presentation, and I hope you have understood a little bit more about what Medicare is and how it can help you. And for further explanations, or if you need to find out more details, please do not hesitate to contact me at the below number, or you can also contact my colleague, which I will display on the next slide, James Collins. Thank you.
Hi, my name is Jim Collins. I'm an insurance agent. I've been in insurance for 15 years. Me and Sam work together. You have my number there on the website. It's collinsinsurance.com. There you can get anything you want: health insurance, life insurance, vision, dental, accident, Medicare. You can get it all. So like I say, give either Sam or myself a call. We can help you out.